Hello, Rise Against Hunger Goes Live audience. My name is Dominic Alexander. I am the Regional Community Engagement Manager for our Mid-Atlantic region. I've been with our organization for 11 years, and in my current role, am responsible for overseeing our program in Raleigh, North Carolina, Charlotte, Eastern North Carolina, as well as Lynchburg, Virginia, and Richmond, Virginia, which is where I'm based. I'm very honored to introduce Edna Ogwangi. She is our Chief Impact Officer, and very honored and pleasure to be interviewing Edna here today.
Thank you, Dominic, and I'm really excited to be on this live Rise Against Hunger live joint interview because it's exciting that we are all here. And as Dominic said, my name is Edna Ogwangi, and I'm the Chief Impact Officer here at Rise Against Hunger. What that means is I oversee the impact of the work that we all do with the contribution from our donors, our volunteers, like you all who are listening, and all the people who receive our meals, our impact partners and our beneficiaries. I get that impact and share the good work we do. I've been with Rise Against Hunger for about 5 years now. I'm located here at Raleigh, and just a brief overview of what I do. Pretty much my experience is in the food security region, meaning I would like to end hunger, and that's why I work for this organization, but also with a big passion of working with school children. That means our meals go to our school feeding programs around the world.
Edna, thank you so much for that introduction and for joining me and the audience here today. I'd like to share some details with our audience about Rise Against Impact in 2019, as well as what our plans are for 2020 amidst what's happening with COVID-19 and the pandemic that's happening right now. First off, can you give us a snapshot of Rise Against Hunger's global impact results from this last year and how many beneficiaries that we were able to support in 2019?
Certainly, together with our 5 international locations, which are based in the Philippines, India, South Africa, Italia, and Malaysia, we were able to support almost 1.8 million beneficiaries. And this is one of the tops for the last 5 years. We've kind of made entrances to make sure that our beneficiaries benefit more than ever. And we really did a whole lot in packaging our meals. We did package 70 million meals, which we were able to distribute to 36 countries around the globe. Rise Against Hunger meals were distributed in 935 schools around the world, and 33,000 of those beneficiaries are not actually students, but farmers. And this is really incredible to share the story of we are not only doing nourishing lives and school feeding for our children, we are actually doing empowering communities where agriculture programs are provided so that they can continue growing food on the ground. These projects together, we were able to reach, like I said, 1.8 million people, including a whole lot of what we do with our children, but also including the farmers on the ground.
Thank you, Edna, for that great snapshot. I know we're still less than halfway into 2020, but we're in the middle of an unprecedented time and a health crisis that has also brought a lot of economic uncertainty. It's been reported that more than 185 countries in the world have coronavirus cases. This is truly a global situation. Therefore, how do you expect COVID-19 to affect our beneficiaries and vulnerable populations around the world, and what are we already seeing?
Thank you, Dominic, for that question. As COVID-19 affects or threatens and touches almost all the countries we've had around the globe, Rise Against Hunger is not immune not to be able to actually respond because, as I said earlier, we work and reach to about 36 countries. So when we received the news about COVID-19, we were really eager to hear and to learn which countries are being affected earlier on, and that helped us to actually be more proactive in that. space. We found out that about 15 countries currently that where we distribute our meals are being affected with COVID. How are they being affected? Really, this was key for us to actually see how we can intervene and also support our impact partners and beneficiaries. We found out there were new regulations that were changing the way operations work in these countries. Some of these new regulations were not different from what we are experiencing here in the US, where we have shelter in place, there were lockdowns, schools were being closed, similar to what's happening again here in the US. We are seeing children back home, and we have to stay home with our kids. And so it kind of affected what we do, which was relating to what's happening here in the US. That said, we needed to be very nimble and very adaptive in the way we can see the kids who receive our meals are able to be supported. And again, I'm going to bring the equation of what's happening here in the US because it's so relevant. We found that hunger is a very big global issue, and food security does not have boundaries. When people are hungry, we are able to see how they react. So what we did as an organization, we looked at various ways we can, first of all, see how we can work and monitor with our impact partners who are working directly with our beneficiaries, and also to see how we can react and support, knowing how in this day and age, economic security is actually influenced in a very holistic way. When there is no food availability, or no food access to our beneficiaries, it plays a big role on people, or the children that we feed. They'll be able to be hampered, A, not to have nutritious food in their homes, B, their parents not having access to buy any food, and C, impacting not only the food security that we are having or economic insecurity, but political insecurity for the countries actually we work in. So those who are being affected by hunger and malnutrition are really vulnerable, not in terms of like COVID now. They are vulnerable to illness and disease. They are vulnerable in a way that we can be able to reach them. Right now, as present, we are seeing almost 250,000 of our children being affected because they don't have to go to school. However, the good news is we are tracking and making sure that kids can also get a take-home ration so that they can be able to get the food that they have. With the meal shortages that we are seeing, it's affecting us because we know the kids will be impacted if we don't have more meals coming. But we are hopeful, and again, we are hopeful that as volunteers who are watching this, they are able to stick with us during this time, and we can be able to actually sustain our meal contribution in the coming months.
Thank you so much for speaking to our impact, Edna. With the 2019 impact results, you mentioned the number of meals that were consumed. Volunteers packaged more than 77 million meals in 2019. The health and the safety of our volunteers is always of the utmost importance, and we've been closely adhering to CDC and government guidelines regarding mass gatherings. And over 500 of our meal packaging event experiences have been canceled or postponed or rescheduled over the past couple of months. How does that impact our ability to support our beneficiaries, and what are we doing to ensure that our beneficiaries continue to be supported even if these meal packaging events are not happening right now?
Understanding that our meal inventory has been shrinking as we haven't been able to package in the capacity that we've previously done, since most states where we package meals have been on shutdown or in shelter in place. It's been concerning, but Rise Against Standard number one priority has always been how do we meet the needs of our beneficiaries, because those are the key stakeholders that we serve. So as an organization, we are very much committed in supporting them no matter what. And what we did as an organization is to develop a 3-step COVID-19 relief plan and resiliency plan, as I can call it. This is where we are able to support our beneficiaries during the uncertain times.
Thank you. Now, can you share a little bit more about this 3-step COVID-19 relief and resilience plan?
Absolutely, Dominic. This is an interesting plan because with every emergency, there's always this saying that you can always have a plan B. And this is important for everyone to hear and listen. So plan B went into motion to have a 3-step plan in that first, we want to continue to do the food distribution that we have currently in the inventory. We are lucky that our volunteers had done a lot of work during the first 2 months of the year, and we did have some inventory surplus in our warehouses. So we are doing our best to make sure that the meals we already had will be distributed in real time so that our beneficiaries can continue getting the take-home rations. Secondly, we have already inventory of our rice so that we could package more meals in the Q2 and Q3 timeframe. However, we realized that without you volunteers coming to help us package our meals, we couldn't use the rice. So our plan B stepped into place where the inventory of our rice that wasn't yet packaged could be actually utilized to be distributed in certain countries, about 15 of those countries where we work. And that has really helped us in a way to provide that support. I would also highlight that food is, in the US, we've realized that people are also in need here in the US. And one of the things as an organization we focus to is to help in ways we can domestically. Some of the rice that we've had, we've actually helped and assisted some food banks here in the US. This is really key because while we are focused internationally, we know that food is also local. We have to help our neighbors, and the neighbors are you volunteers, all of you who come and help us during the international side of things of hunger, but also there's need in the US. We are helping that in a way where our rice can be utilized in a very meaningful way. Step number 2, because we know that our rice and our meals will be depleted, and we don't know how long this COVID will take, we are taking an action on how can we provide small grants for purchasing local food for our impact partners on the ground. We know there are opportunities where we can utilize alternative means of cash-based assistance in country for our impact partners to buy food for the children that we serve. This is really critical at this time, and we are trying in a way for it to be a small and short gap for us so that we can do this program meaningfully. And thirdly, as everyone knows, and I did mention earlier on that we do support farmers on the ground. We have the Empower Communities through our sustainable agriculture. We would like to continue with the programs that we have in Malawi, in Mali, Senegal, and Zimbabwe, so that we can build the capacity of local farmers. We know very well, once these farmers have enough food, they will be our key partners to distribute the same food, A, to the schools as homegrown school feeding, and B, to their families, so that we can create food security at the end of the day. So at this 3-step, continue our food distribution efforts to provide short-term grants for purchasing of local food, and 3, empower communities through these sustainable agriculture projects will help us to be more prepared, more resilient before we go back to our normal business line of packaging meals when COVID-19 subsides.
Thank you so much, Edna, for sharing that information and for all the insightful information that you've shared today on Rise Against Hunger Goes Live. Thank you so much to our listeners and our donors, volunteers, our listening audience. Thank you so much. Thank you, Edna.
I'm glad that we had the opportunity to chat with you, Dominic. Thank you for all your continued support and commitment to see a world without hunger in our lifetime. Thank you.